Clients come into my office and they have many questions, not just about the legal side of things, but about the medical side of things. Hi, I'm Joe Williams. I'm a mesothelioma trial attorney, and I want to talk to you about mesothelioma and some of the different issues related to a mesothelioma diagnosis. When a patient is diagnosed with mesothelioma, the best way to diagnose this malignant cancer is through a biopsy. And what that means is that a surgeon, the patient's referred to a surgeon who will either do a needle biopsy, and the needle biopsy takes a biopsy of a piece of tissue, or it's done intraoperatively through something called a VAT, V-A-T, video-assisted thoracoscopy, which is a minimally invasive procedure wherein a surgeon goes into the chest cavity through 3 incisions, small incisions, and is able to, with the assistance of a video camera, visualize the area and take a tissue biopsy, which can later be evaluated under a microscope. Now I want to talk to you about some of the different cell types involved in mesothelioma. There are 2 main cell types of malignant mesothelioma. There is the epithelial cell type, which is one type of malignant mesothelioma tumor, and there is the fibrosarcomatous or sarcomatoid cell type of mesothelioma. There's also a combined cell type which is made up of a mixture of the 2 called biphasic mesothelioma. Now, regardless of the cell type of the malignant mesothelioma, the treatment options and the treatment techniques performed by the doctors aren't terribly different. But what I think is important to most patients is that the sarcomatoid mesothelioma seems to grow a little bit faster than the epithelial. And I'm sure that's very important to most patients. Now, in looking at this diagram, we see here a right lung that has both asbestosis, which is scarring within the lung, and a tumor, a malignant mesothelioma tumor that encases and completely is surrounding this particular patient's right lung. And this tumor grows in the pleural space, and the pleura is wrapping on the outside of the lung, adherent to the outside of the lung, and a wrapping adherent to the inside of the bony rib cage. It's been described as having the texture of saran wrap. And it's in these 2 pleural surfaces, the visceral pleura, which is adherent to the lung, and the parietal pleura, which is adherent to the inside of the rib cage. It's within these pleural surfaces that malignant mesothelioma grows. Now it's this area, this malignant tumor, which the surgeon has to locate during the video-assisted thoracoscopy and take a biopsy of this malignant material. Now, that material is then sent to a pathology lab at the hospital. Sometimes it's done intraoperatively. They take what's called a frozen section, and they can get a fairly quick response as to what the tumor is. But with mesothelioma, it's always sent for a final diagnosis, which takes at least a week or more, in which certain staining is done of the material that's on the slides and that is reviewed under the microscope. And after that time has passed, the pathologists have an opportunity to do this staining and to make a decision as to what they're seeing under the microscope and to make a final pathological diagnosis of this disease. Sometimes that material is then sent out to another hospital for a second opinion. And that's the process of how mesothelioma is diagnosed through a biopsy. You have questions about mesothelioma and about asbestos exposure. I'm Joe Williams. I'm a mesothelioma trial attorney, and we answer questions like this every day. We represent victims of mesothelioma and their families each day and every day. If you have questions, I invite you to contact our office. We will answer your questions. Thank you.